Connecting you with infectious disease experts in Boston for insight into the coronavirus pandemic. And tonight we're joined by Dr. Brian Hollenbeck, Chief of Infectious Diseases at New England Baptist Hospital. Thank you for being with us tonight. As you know, as we all know, there have been large protests in many cities around the country, including yesterday in Boston. When we look at those events, all the people that are involved, what is the risk to public health right now?
Well, we're at a point in the pandemic where we're starting to open things up. We're starting to see some signs of improvement. And we know that a lot of that is from social distancing, from wearing masks in public, and from doing the right things as a community. But we're also at a critical point where as we open up, we need to continue to do a lot of these measures to make sure that we don't go backwards. So that's where we stand. And I think as we see the protests, there are right ways to do it and there are wrong ways to do it. And thousands of people figured out the right way to do it yesterday. But there were some that didn't have masks on the right way and were within 6 feet. And so that could be an issue.
And to your point, we did see a lot of protesters who were wearing masks, but as you said, not maintaining that 6 feet of separation. That can be hard, of course, in these kinds of situations. So do you think that anyone who attended should get tested? Should they quarantine? Or what about first responders?
Well, I wouldn't recommend testing unless symptomatic or unless you're around somebody that you know was symptomatic or had COVID. Right now, we're still following the state's guidance for that, and they're recommending that everybody monitor for symptoms and know the symptoms of COVID-19 and seek testing and treatment if you have symptoms or if you've been around anybody that's known to have COVID-19.
Do you think quarantine is necessary? Not at this point, it sounds like.
Not right now,
yeah.
No.
Okay. All right. So we're several weeks into the state's first phase of reopening. The governor today even talking about phase 2, which could potentially happen next week. What data will you and your colleagues be looking for this week that would indicate it is safe to move ahead with that phase 2?
Well, we'll be wanting to watch the number of case counts each day to make sure that the number of daily cases is continuing to go down overall. We're usually watching a 7-day moving average of that number. And we'll want to see that that's not changing over the next week or so. We're also looking at the percentage of tests that are being done that are positive, and we'll want to see that that's continuing to go down. And there needs to be enough hospital capacity throughout the state. So we're monitoring the number of hospital beds and ICU beds and certain metrics like that.
Yeah. All right.
In addition,
yeah, go ahead. Sorry.
In addition, for each sector, there are some features that need to be looked at specifically. And for healthcare, one of the things that we're looking at is to make sure we have sufficient personal protective equipment and equipment for surgery, making sure that we can move patients through the hospital safely. And we believe we'll be able to move forward if the governor says on June 8th, hopefully.
Okay, so 4 big things to watch there. All right, but it sounds like everything trending in the right direction. Dr. Hollenbeck, thank you so much for your time. We really appreciate it.
Thank you.